Hi friends, welcome to PharmaGrid. So today in this video, we will continue with the patient case based questions. So question number 11. A 67-year-old hospitalized patient with a deep vein thrombosis of the left calf and pulmonary embolism is currently on intravenous heparin on an hourly drip. Unfortunately, because of a calculation error, the heparin drip is running at 100 times the rate it should be running at. Protamine sulfate is immediately given intravenously. The antidote for heparin is protamine sulfate. This agent works by which of the following mechanisms of action? So here we need to find out the mechanism of action of protamine sulfate in this situation. The options are agonist, chemical antagonist, functional agonist, partial antagonist. So here the correct answer is option B, that is chemical antagonist. A chemical antagonist prevents the actions of an agonist by modifying or sequestering the agonist so that it is incapable of binding to and activating its receptor. Protamine sulfate, which is an antidote for heparin, it acts as a chemical antagonist for heparin. Then remaining all other options. Option A, which is agonist. Agonist is the biologic response produced by a drug binding to its receptor. Then functional antagonist can act at separate receptors than the traditional antagonist. Then partial agonists have activities somewhere between the full agonist and no agonist activity. Then option A, that is partial antagonists have activities somewhere between the full antagonist and no antagonist activity. Next question. A 61-year-old man is taking over-the-counter pseudoephedrine for cold and flu-like symptoms. Over the course of the next few days, he experiences improvement in his rhinitis but should be concerned about the possibility of which of the following problems. So here we need to find out the adverse event or the side effect associated with the pseudoephedrine in this patient. The options are contraction of the iris causing visual changes, constriction of the bronchioles causing increased pulmonary secretions, erectile function improvement, thinning of his salivary glandular secretions, urinary retention. Here the correct answer is option E, that is urinary retention. Pseudoephedrine is a sympathomimetic agent that can cause relaxation of the detrusor and contraction of the external urethral sphincter. This can result in urinary retention, an important concern to warn older men about who take this over-the-counter agent. Then adrenergic agonists usually they will cause dilatation of the pupils, bronchodilation, then stimulate ejaculation, cause thickening of the salivary gland secretion. Hence, the correct answer came as urinary retention. Remaining all other options are wrong. Next one. A 15-year-old boy who has diabetes and is insulin dependent is brought to the emergency department after collapsing at a baseball game. His blood sugar is 463 mg per deciliter by finger stick. Which of the following routes of administration would be most efficacious for medications to bring the blood sugar down? The options are intramuscular, intravenous, oral, subcutaneous, sublingual. Here the correct answer is option B, that is the intravenous route of administration. Insulin, as most of the other drugs, needs to enter the bloodstream for maximal effect. IV infusion will result in the fastest and highest peak blood insulin concentration. There are many formulations of insulin for intramuscular or subcutaneous injection, but even the fastest have no effect until the insulin reaches the systemic blood circulation. Then let's see the other options. Intramuscular insulin can be given in rapidly acting formulations, but even this is not as fast as IV insulin. Then insulin given orally would be broken down and rendered ineffective by peptidases in the gut. Then subcutaneous insulin can be given in rapidly acting formulations, but even this is not as fast as IV insulin. Then insulin is not normally given sublingually, and sublingual absorption is slower than IV infusion. So question number 14. You receive a call from a frantic mother whose 3-year-old son ate a handful of her amitriptyline. Amitriptyline is a tricyclic antidepressant and also a weak acid. You instruct the mother to take her son to the emergency department where he is given bicarbonate in addition to other measures. So what is the most likely explanation for bicarbonate administration in this case? The options are bicarbonate should not have been given, a weak acid such as ammonium chloride should have been given instead, or bicarbonate traps amitriptyline in the blood to keep it from reaching its active site. Ion trapping the amitriptyline in the urine to hasten elimination is accomplished by giving bicarbonate. And the last option is weak acids such as amitriptyline are chemically inactivated by bicarbonate. So here the most likely explanation for bicarbonate administration is option C. that is ion trapping the amitriptyline in the urine to hasten in the sense to fasten the elimination is accomplished by giving bicarbonate. So excess bicarbonate is rapidly excreted in the urine, raising the urine pH. Any weak acid such as amitriptyline that enters this basic urine will become ionized. Once ionized, it is not reabsorbed and so is effectively trapped for excretion in the urine. So remember the two golden rules, that is, the drugs require same medium for absorption and opposite medium for excretion, and only the unionized drug will be reabsorbed or absorbed, whereas the ionized drug will be excreted. Then let's check out the other options also. A weak acid led to acidic urine. Acidic urine would cause amitriptyline to be less ionized and therefore more effectively reabsorbed. Then bicarbonate is rapidly excreted in the urine to maintain physiologic pH in the blood. It is not therapeutically reasonable to manipulate the blood pH for the purpose of ion trapping. And the D option is also wrong because weakly acidic medications are not generally inactivated by bases. Next question. An 80-year-old male nursing home resident is hospitalized on a morphine drip to control pain for his terminal metastatic pancreatic cancer. Morphine undergoes phase 1 and phase 2 metabolism in the liver as well as being metabolized by other enzymes. Some of these metabolic reactions decrease with age. Which of the following metabolic reactions is likely still intact in this patient? The options are glucuronidation, hydrolysis, oxidation, reduction, unmasking of a functional group. Here the correct answer is option A, that is glucuronidation. So morphine is an opioid drug. It is metabolized by P-glycoprotein on enterocytes. Then phase 1 metabolism is by the cytochrome P450 isoenzyme C by P3A4, and the phase 2 metabolism is by a glucuronidation. So phase 1 metabolism usually involves oxidation but may involve reduction or hydrolysis and results in the unmasking or addition of functional groups such as OH, COOH, 2SH, 2NH2. The goal of phase 1 metabolism is to render the molecule more water soluble. If after phase 1 the drug is sufficiently water soluble, it is excreted. If not in the sense if it is not sufficiently water soluble, it may additionally pass through phase 2, which involves conjugation with a highly polar moiety. In some cases, a phase 1 reaction may follow a phase 2 reaction, but often the phase 1 reaction provides the functional group needed for conjugation, which is the phase 2. Phase 1 metabolism is generally decreased in the elderly, whereas phase 2 remains intact. Of the options listed, only glucuronidation is a phase 2 reaction. We would expect the other reactions to be decreased in this patient. So, we have completed today's question discussion. Thank you for watching this video. Have a nice day.